Hey Glam Dolls and Gents, it's Tanya coming to you from the Glam Queens Kingdom for segment 2 of the double mastectomy conversation. So for this part of the segment, I invite you to grab your favorite coffee, favorite beverage, favorite tea. I'm going to have a cup of tea in my wonderful coffee mug that's just like glam, like, yes. And so I actually brewed a cup of a Moroccan mint green tea with a turmeric bag as well. I also added a Fisherman's Friend cough drop and a little honey just to kind of give it some oomph, and to kind of make sure that I'm clean and opened up in my chest area for breathing and just feeling really good. So anyway, let me take a quick sip. Oh yes, that's refreshing and delicious. So at any rate, I just wanted to discuss my upcoming breast augmentation surgery. My pre-op was on yesterday, which is good for 30 days. So you have to have your surgery, your surgical procedure within 30 days of the date of your pre-op completion. So anyway, that's going to give me plenty of time because my actual surgery is scheduled for July 7th, 2020. So that's in a couple weeks. So that will actually be 4 days before my birthday. So I'm going to have some new tatas for my birthday. Yay! So anyway, that's not okay. So the purpose of this was to just discuss that. So the upcoming surgery. So as previously discussed, the bilateral mastectomy, the 5.5 months of aggressive chemo treatment, 2 blood transfusions, the bilateral mastectomy last August, and then the 25 rounds of radiation, and then the final round of chemo in pill form started January 1st, 2020, and I completed it on April 28th, 2020. So yeah, I've just been resting, recovering a lot from those procedures. And then so all this time since actually last August when I had the bilateral mastectomy, I've had these tissue expanders in, and I'm not sure how long you're supposed to have them in, but I was told that originally I believe that they have to be in at least 4 months after your radiation is complete. That'll give your body time to recover a bit from the radiation burns or whatever from the radiation treatments. And then I believe my radiation team told me that I would have to wait, I believe, 6 to 9 months after completion of the radiation to actually do the final implants. That way your body has an opportunity to heal. So I went to see my plastic surgeon about 2 weeks ago, and almost 2 weeks ago. And he informed me, like, no, you need to be in here. Like, we wanted you in here before now. But anyway, it's okay. We can get you in or whatever. We'll, he took a look at everything. Everything looks great. I told him that I wanted mounds. Like, like, I don't need to be like, of course, I don't need to be Dolly Parton size, but I need some like, like I want to see mounds. I want to see, ooh, you know what I'm saying? Like I need something. So anyway, he said I got the picture. So I did that with him too in the room. I was like, I need some. He was like, okay. He had to chuckle. So anyway, that's what I'm looking forward to see the final outcome. So I believe he may try and do, instead of opening up the incisions, which I believe the standard method is to open up the incisions where you actually had your bilateral mastectomy. But I believe he mentioned that he was going to do like a small incision underneath. So I'm not sure, maybe so that when I'm a little fuller, you know, underneath you won't see the scarring anyway, because the new breast will be, you know, kind of sitting hopefully up and out a little, so it would kind of hide this little area. But anyway, we're going to see in a couple weeks how this goes, and you know, I'm going to bring you an update on the little chest enhancement. So I'm kind of excited about it, actually. And I think more the excitement is more towards the fact that I will be done with everything. This to me is the final chapter of this book, this journey. And then I believe once I get to that point, I can start actually healing, and really, really healing. Like, I just feel like there's still an open part of this story that I can't seem to get past until I complete that final chapter, if that makes any sense. Like, I feel like I need that final chapter to be able to close this particular event in my life, and then to start living again. I feel like this, you know, illness has taken so much from me that you know, I used to travel all the time, and I'm so grateful because I found myself over the last few weeks looking at some of my previous travels to, like, Morocco and Dubai and where else? Abu Dhabi. Where else? I went to Prague, Czech Republic. I went to Budapest, Hungary. I went to Vienna, Austria. Iceland. I went to where else? Let's see. Oh, my last trip was to Greece. The Greek islands. I went to Athens, and then I went to Mykonos, and then I went to where did I go? Mykonos. I went to Athens, Mykonos, and then I went Santorini. Yes, went to Santorini and then back to Athens for a couple more days. So anyway, I've had some amazing travels, and those things have, those views and previews and of those videos and things that I made and experiences that I had while I was in those countries have been a blessing and amazing. So even with this pandemic, I wouldn't have been able to travel now anyway. So I'm so grateful for making those memories before I actually, you know, was diagnosed with the cancer. So they have been a blessing. And I just said, I remember saying to myself that I wanted to travel, you know, and make memories everywhere that I went, so that if one day I wasn't able to travel, whether it be to injury or old age or whatever, that I'll be able to look back on my videos or whatever and feel like I'm still there. And that's exactly what these videos have done for me. So some of them are actually posted on my YouTube channel. So go and see some of them, just preview some of them or whatever. The experiences have been amazing. So anyway, so I will bring you guys along with me once I get to the point of the surgery. Okay, so don't judge me. I'm still experiencing a bit of chemo brain, and yeah, so the chemo brain is just like, you know, don't judge me. I may say something or forget. I could be a mid-thought like, oh yeah, that's what I meant, or not remember it at all. So don't judge me. Don't hold me against. Don't hold it against me. If I come across as being forgetful or whatever. So I'm blaming it all on the chemo brain. So anyway, I love you guys, and thank you all for your support and love, and just for all of your kind words and encouragement. Through this journey, and I'm just grateful for you all, and know that I love you. Please be encouraged, and if you are dealing with the same matter, you know, feeling the same way, you're not alone. We're all in this together. I mean, we may have different circumstances or whatever, but breast cancer is breast cancer. Cancer is cancer, and if you've been able to live through it up to this point, God bless your very soul. And just want you to be encouraged to keep pushing forward, keep living, keep loving your life, love your loved ones. And yeah, we will be back. I'll be providing you guys an update soon as to when, how things are going. Maybe the night before, I will give you another update as to my final moments of having these tissue expanders in. So anyway, I will be back soon. And don't you glam dolls and gents forget to check out my other videos. And if you're not already subscribed to my channel, please do so. It doesn't hurt anything. And if you want to be notified when I upload a video, hit the subscribe, the bell, just the bell notification button. So anyway, at a minimum, you should be subscribing to this channel anyway, because I'm bringing you all kinds of stuff, from medical updates to glam travels to just glam chats or whatever, over coffee, over tea, over wine. We'll get to that. You know what? I might have to do the wine one, the wine chat, the glam wine chat after the tatas are in. Yes! So anyway, we'll be back. I will be back, and I promise you, God is faithful. Keep trusting him. Love you.